Hello, Lisa Broyles here with Way to Health MD, and I wanted to talk to you about Bredesen's new Brainscan Report. This came out last fall, and if you already know, I am a practitioner certified in the ReCODE protocol under Dr. Dale Bredesen, MD, neurologist. So Dr. Bredesen and his colleagues have developed 3 blood tests called the Brainscan Report that can predict if you will develop Alzheimer's in the future. I think this is extremely helpful for those of us that are younger and have no signs of any cognitive decline at this time and just want to know for the future. So I'm going to break down quickly what this test entails. There are 3 biomarkers, the p-tau217, the GFAP, and the NFL. So the p-tau217 you might have actually heard of. Tau is a protein that makes up something called a microtubule in the neuron. I think of microtubules like veins or blood vessels. So the microtubules are what carry minerals, nutrients, whatever, through the neuron, okay? And this is a protein that helps make up the tubular structure of the blood vessel, if you will, in the neuron. It's called a microtubule. So phosphorylated tau protein is the p-tau. 217 is the specific type of tau that is most specific for Alzheimer's disease. Okay, so this test is currently being offered by LabCorp, by Quest, and by Bredesen, but what makes this test unique is that he's offering these other 2 complementary tests with it. So the p-tau test is a good predictor of your risk of developing Alzheimer's in the future. It's best associated and most specific for Alzheimer's. So that's nice because some of the other tests can't distinguish between other types of brain damage like ALS, prion diseases, frontotemporal dementia, chronic or brain injuries. Some of those will be elevated with those, but the p-tau217 is specific to Alzheimer's. So when a neuron has been damaged, that microtubule collapses and it goes from trying to support itself through nutrients to just protection, and it collapses and forms what we call a neurofibrillary tangle, and those create amyloid deposition, which you've probably heard of. So the p-tau is a measure of amyloid deposition, but you can often detect elevated p-tau levels at least 2 years, if not 5 years, before the onset of any cognitive decline. The average is 2 to 6 years before a diagnosis of Alzheimer's that a p-tau217 will be elevated, okay? So I think that this is important. I will make one caveat. If you do get a p-tau217 and it's artificially high and you have no symptoms, it could be because of rapid weight loss. So if you lost weight, quite a large amount of weight recently, say you're on a keto diet, you may have a falsely elevated p-tau, which should then be retested a couple months after your weight has settled out. So the next thing that this test looks at is the GFAP. So the GFAP is more looking at what's supporting the structure of the neuron. These are called astrocytes or glial cells. I think of them as the scaffolding holding the little neurons, which are your brain cells, together. Okay, the supporting structure. How healthy is the supporting structure, okay, that is holding the brain cells together? That's what the GFAP test is looking at, and currently this is the most new test and it's not available right now by LabCorp or Quest, but the GFAP can also be elevated for any kind of brain-altering neurodegenerative condition. So that could be vascular disease, like high cholesterol could cause it to be high. If you've had a stroke, if you've had traumatic brain injury, like a fall, concussion, car wreck, things like that, those can all cause the GFAP to be high, because think about it, anything that damages the brain is going to make the platform, the structure that's holding the brain together, damaged, and that takes time to repair. So that's what the GFAP stands for. We do recommend that you not do any heavy exercise, such as standing on your head for yoga or anything like that, for 1 to 2 days prior to getting the blood drawn, as heavy exercise, especially anything where you're tipping yourself upside down, can falsely elevate the GFAP. The last test we look at in the Brainscan report is the NFL, which is looking at the neuron itself and is there damage occurring in the neurons. So this one also isn't necessarily specific to Alzheimer's. You can see high levels with frontotemporal dementia, traumatic brain injuries, ALS, It peaks about 6 days after an acute injury, but it is important to measure both the health of the neuron and the health of the structure supporting the neuron, and then of course the p-tau levels to assess the risk for Alzheimer's dementia specifically. So if you are interested in this test, none of these are currently covered by insurance from any lab. Dr. Bredesen's offering it. If you go to getabrainscan.com, you can order the test without a physician's order. They will give you some lab draw sites near you where you can go get the blood drawn. So Dr. Bredesen recommends that you have the Brainscan report done every 5 years before the age of 50, and after age 50 every 2 years, because if we know about it early, we can prevent it from ever happening. Thank you.